Hello everyone, welcome to my channel. Today I am going to take the topic anti-epileptic drug. This is the third video on the anti-epileptic drug. Let's quickly revise the first two videos. So in the first video I explained the different type of the seizure and the pathophysiology of the epilepsy. So what exactly happens in the epilepsy? Normally there is a balance between the excitatory and inhibitory neuron. So excitatory, that is a glutaminergic neuron, इसमें आपका बैलेंस एंड गाबानर्जिक दैट इज इनहिबिटरी न्यूरॉन. सो इन दोनों के बीच में नॉर्मली देयर इज अ बैलेंस. इन एपिलेप्सी व्हाट हैपन्स, द बैलेंस बिटवीन द ग्लूटामिनर्जिक न्यूरॉन एंड गाबानर्जिक न्यूरॉन दैट इज लॉस्ट. सो there is a imbalance between these two neuron. So what happens in epilepsy? There is a increased glutaminergic activity or and there is a decrease in GABAergic activity. ये activity कम हो जाती है. Now what the anti-epileptic drug they do, they act by either decreasing the activity of glutaminergic neuron and by facilitating the activity of the GABAergic neuron. So in the second video I started with the anti-epileptic drug. So first part of the drug which are going to increase the activity of this glutaminergic neuron, जो इसकी activity बढ़ा दे. So how we can increase the activity of the glutaminergic neuron? Sorry, decrease the activity of the glutaminergic neuron by decreasing the release of glutamate. And how we can decrease the release of glutamate? By blocking this channel or modifying this channel by decreasing the release. So and then by blocking these receptor, this once the glutamate it is released, it is going to act by these type of receptor. So we can give the drug which can act by blocking these receptor. Now this group of the drug which I have written here, like phenytoin, carbamazepine, oxcarbazepine, then esylcarbazepine, lamotrigine, lacosamide, jonissamide, valproate, divalproex, topiramate and rufinamide, they all act by prolonging the inactivation of the sodium channel. ये sodium channel है, इसको ये इसका action prolong कर देते हैं. So this is the primary action which is seen by or shown by all these drug, and they have no doubt they also have the secondary mechanism. So in detail you can watch the video, link will be given in the description box. Now continuing my third video on the anti-epileptic drug, what are the other drugs which are going to decrease the activity of this glutaminergic neuron? So another group of the drug which is going to decrease the activity of the glutaminergic neuron is we can give the potassium channel opener. So one is already topiramate, that is there. ये यहाँ पे आपका है potassium channel opener. This one is there. So with the opening of the potassium channel, what happen? Hyperpolarization of the neuron will happen. So with the hyperpolarization, what will happen? The glutamate will not be released. So this is another way of decreasing the glutaminergic activity. And drug in this category, we have two drugs. One is topiramate, which already I have discussed with the previous section. So this drug, it first mechanism, it is going to act here by prolonging the inactivation of the sodium channel. Then it is also going to cause a neuronal hyperpolarization by opening the potassium channel. Then the third one is anti-glutamate action by blocking the kainate receptor, and it has also acting on the GABA A receptor. So it is going to facilitate the GABAergic neurotransmission. Inhibitory को ये enhance करता है. So another drug in this category is a retigabane. This is the newer drug. So it is withdrawn from the market right now. Approved in 2011 and in 2017 it is withdrawn from the market because of its side effect. Earlier we reported only urinary retention, but later on because of the various cognitive side effects, now it is withdrawn from the market. Now how you can decrease the activity of the glutaminergic neuron? This is another group of drug, that is a calcium channel blocker. Which type of the calcium channel blocker? It is a T type of the calcium channel blocker. And the drug under this category, we have a valproate, we have ethosuximide and we have a jonicamide. So valproate and jonicamide already I have explained. Valproate मैंने पिछले भी आपको you can see here. This is a valproate. It is a broad spectrum anti-epileptic drug. This I explained. And jonicamide here. This also acts by prolonging the inactivation of the sodium channel. Now the third drug in this category, that is ethosuximide. Now all these drugs, they are effective against absence seizure. इसमें इसको होता है absence seizure. Now in absence seizure, in the first video I have explained about the absence seizure, just few lines. So in the absence seizure, if we see the EEG, so in the EEG we see the synchronous 3 hertz wave and spike pattern, and they say the cause here is because there is a reciprocal activation and oscillation between the thalamus and neocortex. So thalamocortical neurons, they are involved here, and in the thalamus the main channel, that is a calcium channel which is of T type, that is present. Now this drug, they act by blocking this T type of the calcium channel. So all these drugs, they are effective against, they are used for the treatment of absence seizure, and the drug of choice is valproate. Valproate, that is a drug of choice. But the main side effect with the valproate, it is a hepatotoxicity, or you can say fulminant hepatitis, which is very common in the children below 3 years of the age. So if any child below 3 years of age, if gets absence seizure, then we have to give the ethosuximide. We don't use the valproate. Another drug, as a alternative drug, we can give clonazepam. That is also be used for the absence seizure. Here I haven't written clonazepam. That is also used for the absence seizure. So ethosuximide, you can see here the mechanism of action, how you are supposed to write. They act by antagonizing low threshold. They are the not high threshold. High threshold जो आपका इधर neuron में बना हुआ था, this one. I'll show you this one. This is high voltage gated calcium channel, and this one is a low threshold T type of calcium channel which is present in the thalamocortical neurons and which is involved in the generation of the absence seizure. और आपको इसको किस में देना है? Absence seizure in the children who are less than 2 to 3 years. And what are the adverse effect? Adverse effect, so this is only indication, otherwise we do not use this drug much. Adverse effect, gastric distress, you have to start it at a low dose to avoid all that. Then headache, drowsiness, inability to concentrate, tiredness, euphoria, hypersensitivity reaction like rashes, discoid lupus erythematosus, and blood dyscrasia, they are the rare. Now next group of the drug which are going to decrease the glutaminergic activity, that is by decreasing the glutamate activity. कैसे करेंगे? By blocking the different type of receptors. So I told you earlier, glutamate, once it is released, they are going to act on 3 different type of receptor: NMDA receptor, AMPA, and KNAT receptor. Lamotrigine, this is going to block the NMDA receptor apart from other mechanism of action. Topiramate block the KNAT receptor. Falbamate, NMDA receptor, but not used because of the hepatotoxicity and aplastic anemia. And then parampanel. Parampanel, अब सीधा इसमें नाम आता है parampanel AMPA, because this is the only one which is going to act on AMPA receptor. Rest of the drug, you can remember, they act on the NMDA receptor. So this is indicated for the focal seizure. Then valproate, apart, it's a broad spectrum. It also has the anti-glutamate action. It blocks the NMDA receptor. So far I have explained the anti-epileptic drug which act by decreasing this glutaminergic, जो इसको कम कर दे, वो वाले मैंने सारे आपको बता दिए, ये वाले. So कौन कौन से हैं? The drug which is going to cause the prolongation of, ये number 1, prolongation of the sodium channel, which is going to prolong the inactivation of the sodium channel. ठीक है. फिर उसके बाद आपका ये कैल्शियम वाला भी हो गया, then potassium channel opener here, ठीक है, topiramate and retigabine, these are the drug. And then we have the T type of the calcium channel, which is blocked by these three drug plus clonazepam I have added. Then the drug which are going to decrease the glutamate activity, so these two, they are a newer addition. So baki lamotrigine you have read this side. Now we will start with the drug which is going to increase this GABAergic transmission. अब ये वाला part है which is going to increase the GABAergic transmission. Let's see what are the drug which act or which enhance the action of the GABA. So in this category the number one is barbiturate. Barbiturate में आपका phenobarbital. Then we have a benzodiazepine. So both these drugs, they are going to act on the GABA A receptor. So they have a GABA mimetic and GABA facilitatory action. Then we have a vigabatrin, tiagaban, sodium valproate. This already I have explained there. Then newer drug which is a barbiturate derivative, that is tidipantol. These are the drugs which are going to enhance the action of the GABA. I'll take one by one. So coming to the first one, you can see here how this one GABA, how it is synthesized. This is synthesized from the glutamate by the action of this glutamic acid GAD. It is from the glutamic acid decarboxylase. The full form is glutamic acid decarboxylase. With the help of this enzyme, the glutamate that is converted into GABA. ये GABA में आ जाएगा आपका glutamate that is converted into GABA. ठीक है? So once it is synthesized, then what will happen? Again here the same thing, the action potential, the inward movement of the sodium, then there is a action potential that is generated, then calcium will enter, then this is going to cause the release of GABA. And once it is released, then it is going to act on the receptor. This is a benzodiazepine, sorry, GABA A. This is a GABA A benzodiazepine chloride receptor. GABA के भी बेटे दो receptor हैं, GABA A and GABA B. GABA B, it is a metabotropic receptor, or you can say it is a G protein coupled receptor, whereas GABA A, this is a inotropic receptor. तो ये पूरा है GABA A benzodiazepine chloride receptor complex. So this GABA, it is going to bind here. So what will happen? There is an inward movement of the negative ion, chloride ion. So that leads to neuronal hyperpolarization. So now once this neurotransmitter, it is going to act on the receptor. Now what is the fate of this neurotransmitter? The reuptake is by GABA transporter 1. So it will be reuptake within the neuron. Now within the neuron, it is metabolized by the GABA transaminase into the succinic aldehyde. इसमें ये वाला convert हो जाता है, this one. Now different drug, they are going to act at different site, and by acting they are going to increase the level of this GABA, and they are going to increase the activity of this one. Now we'll start first with the barbiturate. ठीक है, इसके साथ शुरू करते हैं barbiturate. Barbiturate में the most important drug, that is ये phenobarbital होगी आपकी सबसे important. I'll clear a few things so that it will look a little bit neat. ठीक है, so barbiturate, how it is going to act? So barbiturate, it is one of the efficacious and oldest drug 1912 में आई थी, the first anti-epileptic drug. So otherwise it is a sedative and hypnotic, दोनों ही हैं. Barbiturate and benzodiazepine we teach you under a sedative hypnotics. और वहाँ पे बहुत important question आता है, why benzodiazepine they are preferred over the barbiturate as a sedative hypnotics, and both they are used as an anti-epileptic. लेकिन barbiturate में जो as an anti-epileptic use होता है, that is only phenobarbital. So one action is it is going to act on the GABA receptor. So इसका GABA mimetic and especially phenobarbital का GABA mimetic and GABA facilitatory, both the action it is there. Then it is going to act here. This is the number 2 I have written here. So number 2 is here, number 1 is here. It is going to act here at the receptor. It is GABA mimetic and facilitatory. Like it is going to bind with the GABA benzodiazepine receptor complex, and it is going to increase the duration of opening of this chloride channel. तो ये हो गया आपका गाबा माइमेटिक एक्शन. एंड इफ इट इज गोइंग टू इंक्रीज द फ्रीक्वेंसी ऑफ द ओपनिंग ऑफ द chloride channel, then that is a facilitatory. This benzodiazepine, they are mainly GABA facilitatory action. Barbiturate का GABA mimetic है, which we teach you in the sedative hypnotics. But इसमें जो phenobarbital है, that has got both the mimetic as well as a facilitatory action. Then another one is, second one is, it is going to डिक्रीज द एंट्री ऑफ द कैल्शियम. एक बार अगर आपका यहाँ पे कैल्शियम इन द एक्साइटेटरी न्यूरॉन में ये आपका क्या कर रहा है, इट इज़ इनहिबिटिंग द एंट्री ऑफ दिस कैल्शियम. एक बार ये कैल्शियम की एंट्री नहीं हुई तो देन व्हाट विल हैपन, दिस ग्लूटामेट रिलीज. सो एंटी ग्लूटामेट एक्शन, it is inhibiting the entry of the calcium. ये नहीं रिलीज होगा. सेकेंड थिंग इज इट इज ऑल्सो गोइंग टू इनहिबिट द एंटी ग्लूटामेट एक्शन बाय ब्लॉकिंग दिस रिसेप्टर, स्पेशली द AMPA. तो इसके 3 एक्शन हो गए आपके फिनोबार्बिटोन के. फर्स्ट लाइक इन 1912 में आई थी. मैकेनिज्म ऑफ एक्शन आई हैव टोल्ड, इट इज़ गॉट द फिनोबार्बिटोन ही हम यूज़ करते हैं. इट हैज़ गॉट द मैक्सिमम एंटी कन्वर्जेंट एंड दिस इज़ नॉट हेपेटिक, इट इज़ अ hypnotic, sedative hypnotic ratio. It is not hepatic, sorry guys, it is a hypnotic ratio. So anticonvulsant इसकी सबसे ज़्यादा होती है in comparison to rest of the barbiturate, because maybe reason they say minimal effect on the calcium channel and glutamate release. हाफ लाइफ इसकी अच्छी खासी है 18 to 120 आवर, बिकॉज इट्स हाफ लाइफ इज़ लॉन्ग. सो स्टेडी स्टेट, पीछे से पढ़ना है, स्टेडी स्टेट प्लाज्मा कंसंट्रेशन, उल्टा इसको पढ़ना है, इज़ 2 to 3 weeks. So this drug, earlier we were using, the only drawback with this drug is its sedative. इसमें भी sedation है, इसलिए that is only the drawback. So we were using it earlier for the generalized tonic-clonic seizure and both the partial seizure, whether simple partial seizure or the complex partial seizure. But it is not used now because of its dulling and behavioral side effects. Other side effects, they are also there, which we will be seeing in the next slide. And in the status epilepticus we can give, but response that is very slow. It is, what are the other adverse effect? Sedation, I told you, this is the major drawback with the phenobarbital. Behavioral abnormality and dullness, this is the reason why we are not using it nowadays. Diminution of the intelligence, impairment of learning and memory, hyperactivity in children, mental confusion in elderly, and in some patient you will see rashes, megaloblastic anemia and osteomalacia when we are using it for a long time. So this was about the barbiturate. Then the second one is a benzodiazepine. So this is the number 2 drug. So benzodiazepine, under this category, what would we use as an anticonvulsant? There are the 4 drug. One is a diazepam, we have a lorazepam, clonazepam and clobazamine. पहले हमारे पास सिर्फ diazepam ही होती थी, ठीक है. So first 2 we are using IV and these we give by oral route. Now what is the mechanism of action of this drug? So definitely they are the benzodiazepine, they are going to act again by binding with the GABA benzodiazepine. इसका नाम ही ऐसे GABA benzodiazepine chloride receptor complex, but definitely the site for on this receptor for the barbiturate, it is different as compared to the benzodiazepine. So here the site is different. So benzodiazepine, earlier we were using it at everywhere, ठीक है. कहाँ कहाँ यूज़ होता था, फर्स्ट लाइन ड्रग, स्पेशली इन द एमरजेंसी. जितने भी कन्वर्जन्स हैं, स्टेटस एपिलेप्टिकस में कन्वर्जन ड्यू टू टेटनस, एक्लैम्सिया, ड्रग पॉइजनिंग की वजह से हुआ, फिब्राइल कन्वर्जन बच्चों में जब भी होता, पर रेक्टल रूट हम देते थे इसको, रूट ऑफ एडमिनिस्ट्रेशन, इट इज़ अ पर रेक्टल. तो इसको हम वी वर यूजिंग इट, बट नाउ डेज व्हाट हैपन्स, बिकॉज ऑफ lorazepam we are using because it is a better as compared to this diazepam. Diazepam का क्या है, इसका एक्शन बड़ा, because it's a widely distributed, तो एक्शन इसका सस्टेन नहीं रहता था. सेकेंड थिंग इज इफ़ यू गिव इट बाय एमरजेंसी रूट में हमने IV देना, तो इट इज़ गोइंग टू कॉज द थ्रोम्बोफ्लेबाइटिस. तो lorazepam जब आई तो इसने टोटली डायजेपम को रिप्लेस कर दिया, बिकॉज lorazepam इट इज़ बेटर सूटेड देन डायजेपम फॉर द स्टेटस एपिलेप्टिकस, बिकॉज थ्रोम्बोफ्लेबाइटिक कॉम्प्लिकेशन नहीं है इसमें, कम में, sustained action because it's not widely distributed, and the lesser respiratory depression. What are the other 2 drug? The clonazepam and the clobazam, they are given by oral route. इनको हम किस किस में यूज़ कर सकते हैं, वी कैन यूज़ इट. मैकेनिज्म ऑफ एक्शन अगेन इट इज़ द सेम. एंड ये जितने भी बेंजोडाइजेपिन के, चाहे ये लोराजिपाम है, डाइजिपाम है, क्लोनाजिपाम है, क्लोबाजिम है, their main side effect is a sedation because they are used also as a sedative and hypnotic. So clonazepam absence seizure में कर सकते हैं as an adjuvant in a myoclonic seizure, infantile spasm and acute mania. Clobazam हम कहाँ पे करते हैं? It is a adjuvant as an add-on therapy. But these two drug we give by oral route. ये रखो याद, इसको हम oral route में देते हैं और उसको हम we give it by IV route. Now these I already told. The main side effect is sedation, development of the tolerance. Tolerance it develops to the sedation. Then respiratory, depression. Then its effect it's going to decrease the blood pressure. Then the third drug in this group which is going to facilitate the GABAergic neurotransmission, that is a steri. It is a steri. I यहाँ पे भी आएगा steripental. So this is the barbiturate derivative. Benzodiazepine नहीं है. This is a barbiturate, newer oral barbiturate derivative, and which is going to facilitate, which has got the GABAergic action, GABAergic neurotransmission ये बढ़ाएगी. This is the mechanism of action, and it is mainly used for the Dravet syndrome. So what is the Dravet syndrome? It's a rare form of epilepsy which we see in a which starts in the first year age in a baby. Then the next drug is this GABA analog. These are the amino acid analog of the GABA, that is a gabapentin and pregabalin. You can see here. Now these are the amino acid analog. They are the lipophilic. Once you give, they are going to cross the membrane and they are going to increase the release of, ये जो जहाँ यहाँ पे है ना गाबापेंटिन, they are going to increase the release. इसका release ये बढ़ा देते हैं गाबा का. So once GABA releases more, then what will happen? It is going to act on the receptor. तो इसका भी कैसे है? It is a amino acid analog of GABA. तो इसका action भी just like a GABA. Then the second way how it is going to act, it is going to bind this calcium. ये जो आपका कैल्शियम चैनल है, कैल्शियम के सब यूनिट्स के साथ अल्फा 2 एंड डेल्टा 1, इट्स गोइंग टू मॉडिफाई दिस कैल्शियम चैनल. वो इस तरह से मॉडिफाई करता है कि कैल्शियम एंट्री नहीं अंदर होती. इट इज़ गोइंग टू ब्लॉक द एंट्री ऑफ द कैल्शियम, सो देयर विल बी नो ग्लूटामेट रिलीज. सो इसका क्या है? इसका इनिबिटरी एंड एक्साइटेटरी दोनों न्यूरॉन में. एक्साइटेटरी में इट इज़ गोइंग टू डिक्रीज द एक्साइटेशन ऑफ द ग्लूटामिनर्जिक न्यूरॉन एंड इट इज़ गोइंग टू facilitate the GABAergic activity by increasing the GABA release. Now where we are going to, so this is about the mechanism of action. Now where we are going to use this drug, जब भी एंटी एपिलेप्टिक ड्रग आए, एंटी एपिलेप्टिक ड्रग विद द एनाल्जेसिक एक्टिविटी, उसमें हमने क्या बोलना? गाबापेंटिन. इट हैज़ गॉट दी एनाल्जेसिक एक्टिविटी. सो यूजली इसको ये है कि वी कैन यूज इट एज अ मोनोथेरेपी, बट मेनली इट इज़ यूज्ड एज एन एड ऑन थेरेपी इन द रिफ्रैक्टरी पार्शियल सीजर. इसमें करते हैं. देन आई ऑलरेडी हैव टोल्ड कि इट इज़ अ एनाल्जेसिक, सो इट इज़ यूज्ड इन द डायबिटिक न्यूरोपैथी. ये इसके दोनों के दोनों थेरेपेटिक यूजेस है. वेरी वेरी इंपॉर्टेंट. एमसीक्यू भी आता है, वाइवा में भी पूछते हैं. सो डायबिटिक न्यूरोपैथी में कौन सी? गाबापेंटिन एंड प्रीगैबलिन, बोथ दे आर सेम. दे आर फार्माकोकाइनेटिक, फार्माकोडायनामिक, मैकेनिज्म ऑफ एक्शन, मोस्ट ऑफ द थिंग दे आर द सेम फॉर बोथ गाबापेंटिन एंड प्रीगैबलिन. एंड बस ओनली थिंग इज द sedation part. It is less with this, but even lesser with the pregabalin. Otherwise both they are equally efficacious. Post herpetic neuralgia, इन दोनों के लिए आपने इसको देना है. माइग्रेन के प्रोफाइलैक्सिस में, उसमें भी हम दे सकते हैं. फॉर द प्रोफाइलैक्सिस ऑफ माइग्रेन, इसमें आप दे दो. एंड देन इन द फोबिक स्टेट्स, यहाँ पे भी हम यूज़ कर सकते हैं. Then pain associated with the multiple sclerosis. So this is about the gabapentin and pregabalin and their side effect. All the four they are there. And the next group of drug is tiagabine. Now how the tiagabine it is going to act? Now once the GABA it is released, it is going to bind with the GABA benzodiazepine. यहाँ पे ये क्या करेगा? ये गाबा बेंजोडाइजेपिन इस रिसेप्टर पे यहाँ पे ये काम कर रहा है. नाउ वंस इट एक्ट्स, देन व्हाट विल हैपन? दिस गाबा इट विल बी ट्रांसपोर्टेड. ये गाबा ट्रांसपोर्टर है, दिस इज अ गाबा ट्रांसपोर्टर, ये इसके साथ आपका ट्रांसपोर्टेशन हो जाएगा, ये ट्रांसपोर्ट करके क्या करेगा, इट इज़ गोइंग टू ट्रांसपोर्ट दिस वन अगेन इनटू द न्यूरॉन. नाउ ट्यागा बीन व्हाट इट डज, इट इज़ गोइंग टू इनहिबिट दिस गैट, गाबा ट्रांसपोर्टर 1 को ये इनहिबिट करता है. इसकी इनहिबिशन से क्या होगा, नो गाबा रीअपटेक विल बी ब्लॉक्ड. अगर रीअपटेक नहीं हुई तो वो कहाँ पे रहेगा, वो आपका साइनेप्टिक साइनेप्स पे ही रहेगा. मोर अमाउंट विल बी देयर विच इज गोइंग टू एक्ट ऑन द रिसेप्टर. सो दिस इज ऑल्सो गोइंग टू फैसिलिटेट, और गाबानर्जिक न्यूरो ट्रांसमिशन इससे ज़्यादा होगी. सो क्लोराइड will enter negative ion neuronal hyperpolarization, so negative effect. So tiagabine, it is going to act by blocking the GAT1. So इसमें आपको where we are going to use mainly as an add-on therapy. These are its important side effect. Now the next group of drug is, so this is number 5. Next is this लेविट्रासिटम, डेरिवेटिव ऑफ पिरासिटम, नोट्रोपिक ड्रग में आप पढ़ते हो. नो इट्स, इसका मैकेनिज्म ऑफ एक्शन थोड़ा सा है, इसको मैंने सेंटर में लिखा है. कैन यू सी हेयर दिस इन बोथ द न्यूरॉन विद द SV2A. ठीक है, इट इज़ आप 2 बड़ा भी कर सकते हो, इट इज़ SV2A. इट इज़ अ साइनेप्टिक वेसिकल 2A प्रोटीन, ये इसमें ये प्रोटीन. नाउ दिस लेविट्रासिटम व्हाट इट डज, इट इज़ गोइंग टू बाइंड विद दिस प्रोटीन जो यहाँ पे मैंने दिखाई है, ये वाली. ठीक है, इट इज़ गोइंग टू बाइंड विद दिस प्रोटीन प्रेजेंट ऑन बोथ, ये आपका ग्लूटामिनर्जिक न्यूरॉन पे भी और इधर भी, यहाँ पे भी ये है और यहाँ पे भी है, दोनों जगह ये बाइंड करेगा. ग्लूटामिनर्जिक न्यूरॉन पे भी और ये गाबा वाले भी न्यूरॉन पे भी, यहाँ पे भी ये, इसका भी है तो यहाँ पे भी ये बाइंड करेगा. आफ्टर बाइंडिंग विद दीज SV2A और साइनेप्टिक वेसिकल 2A प्रोटीन, इट इज़ गोइंग टू कॉज अ मॉडिफिकेशन इन द रिलीज ऑफ न्यूरोट्रांसमीटर. सो व्हाट दे से, क्या मॉडिफिकेशन ये करता है, ग्लूटामेट की रिलीज कम कर देता है और गाबा की रिलीज ज़्यादा कर देता है. दैट्स इट. So levetiracetam, it is going to cause a modification of the release of neurotransmitter by binding with the SV2A, that is synaptic vesicle 2A protein. ठीक है. So next is group of drug is this 6th हो गया वियागा बैटरीन. ठीक है, वियागा बैटरीन, इसका आपको यहीं से हाउ दिस ड्रग इट इज़ गोइंग टू एक्ट, आप इसको कर दो ऐसे गाबा टी. ठीक है, ये इसमें से गाबा टी निकल आया, I is inhibitor, so it is going to inhibit this enzyme गाबा टी, गाबा ट्रांसएमिनेस. इसको इनहिबिट करके अगर ये इनहिबिट हो गया then what will happen, this गाबा ट्रांसपोर्टर, मैंने पहले बताया गाबा यहाँ पे आया, गाबा ट्रांसपोर्टर क्या कर रहा है, गाबा ट्रांसपोर्टर इट इज़ गोइंग टू टेक इट अप, reuptake, and once it is within the vesicle then what will happen, this GABA transporter, this is going to GABA, sorry, transaminase, it is going to cause the metabolism of this GABA. Now vigabatrin, it is going to inhibit this enzyme GABA transaminase. So what will happen, now the GABA which is reuptake, which is taken up by the vesicle within the neuron, it is not metabolized, so more amount will be available. ये फिर से इसमें जाएगा. So इसमें क्या है, इसके साइड इफेक्ट हैं, बट द मोस्ट इम्पॉर्टेंट आप इसमें जो रखो, जो MCQ आता है VI, दैट इज़ अ विजुअल साइड इफेक्ट, दैट इज़, एंड इट्स कॉन्ट्रा इंडिकेटेड इन द साइकोसिस. सो दिस इज़ अबाउट द ड्रग विच इज़ गोइंग टू facilitate the GABAergic neurotransmission. I repeat it again, barbiturate, benzodiazepine, ये आपका हो गया, barbiturate, benzodiazepine, stiripentol, this is a stiripentol, sorry, this is a newer drug. Then we have a GABA analog, gabapentin and pregabalin. Then we have this tiagabine. Then we have a levetiracetam, and then we have a viagabatrin. So another question which is very commonly asked in the exam, that is newer anti-epileptic drug. So newer anti-epileptic drug at different mechanism of action almost I have covered. So how you can attempt this question, newer anti-epileptic drug, you can write the name of different as आप ऐसे भी लिख सकते हो, और you can depending on the mechanism. जैसे यहाँ पे थोड़ा सा missing है, मैं इसको complete कर देती हूँ. This is the first drug, it is a lacosamide. Second one is it is a jonisamide. ठीक है, ये आपकी जॉनिसामाइड है. दिस इज़ अ टॉपिरामेट एंड दिस इज़ अ रूफिनामाइड, ये ऐसे है. ठीक है. So this drug they are going to prolong the inactivation of the voltage gated sodium channel. ये newer drug है. Then potassium channel opener topiramate and reticabine, then which decrease the activity of the glutamate, falbamate NMDA receptor, parampanel फिर से AMPA receptor. ठीक है. Then we have a gabapentin and pregabalin. यहाँ पे मिसिंग है pregabalin. They are going to increase the release of this plus inhibit the release of glutamate. Then we have this stiripentol, barbiturate derivative है, tiagabine, GAT like GABA transporter 1 inhibitor, vegabatrin that is going to inhibit the transaminase. Just now I have explained. So newer anti-epileptic drug जब भी आता आप चाहे एक वेग सा नाम लिखे and then you are supposed to write 2 lines. So most of these drug nowadays we put the patient on newer anti-epileptic drug क्योंकि बेटा इसके side effect कम है, especially the drug interaction part that is very less and we can use it as an add-on therapy and few of them can be used as an monotherapy. ठीक है. अब इस आज के वीडियो में व्हाट आर द इम्पॉर्टेंट क्वेश्चंस जो बनते हैं. न्यूअर एंटी एपिलेप्टिक्स एक इम्पॉर्टेंट शॉर्ट नोट है और किसी भी न्यूअर एंटी एपिलेप्टिक्स पे जैसे गाबापेंटीन, प्रीगैबेलिन ये अलग से भी है, लेविट्रासिटम उसका डिफरेंट है मैकेनिज्म ऑफ एक्शन. ठीक है. देन वेगाबैट्रिन उसका है. तो डिफरेंट एक शॉर्ट नोट न्यूअर एंटी एपिलेप्टिक्स पे याद आता है और उसके मैकेनिज्म ऑफ एक्शन पे आपको फिलअप्स आ सकते हैं कि दिस ड्रग एक्ट बाय ब्लॉकिंग गैट, दिस ड्रग एक्ट बाय मतलब गाबा ट्रांसपोर्टर 1 ये उसको ब्लॉक करती है, गाबा ट्रांसएमिनेस को कौन सी ड्रग ब्लॉक करती है. तो वो छोटा छोटा आपको पता ना. एंटी एपिलेप्टिक ड्रग विद एनाल्जेसिक एक्टिविटी. ठीक है. आपको पता गाबापेंटीन एंड प्रीगैबेलिन आपको न्यूरोपैथी में, डायबिटिक न्यूरोपैथी में ड्रग ऑफ चॉइस. लेकिन यही ट्राइजेमिनल न्यूरोलजिया आ जाए तो कार्बामेज़ेपिन दैट इज अ ड्रग ऑफ चॉइस. देन वाई लोराजिपैम आज की डेट में स्टेटस एपिलेप्टिक जैसे मैंने बताया लास्ट लेक्चर में, लास्ट वीडियो में था, फॉस्फेनेटोइन दैट इज प्रेफर्ड ओवर फेनेटोइन in a status epilepticus. Similarly, lorazepam that is preferred over the diazepam. Then management of status epilepticus, this I haven't covered in this video, but this is also important question as far as the examination point of view. Then the drug of choice for the different type of seizure, all these are the important the drug of choice. This is a usually asked in a multiple choice question. I have just scanned this from the Tripathi. So you can see this here for the different seizure the drug of choice they have given. So one thing which I want to highlight so that you can remember, because I told ki valproate that is a broad spectrum anti epileptic drug. So you can see at many places valproate as a फर्स्ट ड्रग ऑफ चॉइस स्पेशली फॉर द जनरलाइज सीजर. आपको सब जगह दिख रहा है, इवन यहाँ पे भी आपको फॉर द पार्शियल सीजर. ठीक है. हाँ, बाकी फिब्राइल सीजर जो बच्चों में होता है उसमें आपकी डायजीपाम पर रेक्टल रूट दैट इज अ ड्रग ऑफ चॉइस. एंड फॉर द स्टेटस एपिलेप्टिकस वी गिव बोथ बट लोराजिपाम दैट इज प्रेफर्ड. सो एटलीस्ट फर्स्ट लाइन ड्रग you first try to memorize the first line drug and then you can go for the alternative. And for the last section is because of my pick you cannot see, it is a reserve or add-on drug. ये वो वाले हैं आपके. ठीक है. Then mechanism of action, the previous video I told you mechanism of action that is anti-epileptic drug का वो बड़ा important है. So you can write the mechanism of action at different places. I told you on mechanism of action depending on classification of the, so not the mechanism, classification of the anti-epileptic drug, that is a very important question. So classification I have told you at different places depending on the mechanism of action. So this again I have taken from the standard textbook of pharmacology that is by K.D. Tripathi. So here you can see write the mechanism of action depending on the classification depending on the mechanism of action, like the drugs which is going to act by the prolongation of the sodium channel inactivation मैंने ज़्यादा ही बताई है. Then the drug which is going to inhibit the excited glutaminergic synapse which is going to facilitate GABAergic and which is going to act by the T type. आप इसमें और भी ऐड कर सकते हो. So you can write potassium channel opener, इसमें आप वो वाली ऐड कर सकते हो. The another way of the classification is which most probably most of the students they love to write anti-epileptic drug their classification. This again I have taken from the Tripathi. This is a chemical classification of the anti-epileptic drug. So most of the drug I have covered. So whatever classification you find, so you can write it in your exam. So that's all about the anti-epileptic drug. So if you like my video, so please subscribe my channel and put up your important suggestion in the comment box. Thank you.